When, yeah. Well, good afternoon, ladies and gentlemen. The Subcommittee on Labor, Health, and Human Services, Education, and Related Agencies will now come to order. I'd like to thank everyone for making arrangements to be here a little before we have votes so that we can finish this bill and we can hit the ground running. Especially since we have votes coming up, we want to make this as quickly as possible. But I, first of all, want to thank Chairman Cole. Want to welcome him back to this subcommittee. He spent a lot of days in this chair and did a great job, and welcome him back, and of course recognize the ranking member, someone that we may not always agree on all the issues, but I have the utmost respect for. And so, and it's great to have you back, especially after your surgery you have, and glad that you're doing well. But the bill before you today balances the need for responsible fiscal stewardship while maintaining key investments in biomedical research, schools, and public health. Following the President's clear direction, we have taken a critical look at every program and in several cases had to make some hard decisions and look at some very nice to have programs that maybe that we would had to really cut, even though they would have been nice to have. Americans must make priorities when they're sitting around the kitchen table to their own expenses, and we have to be doing the same here in the United States House of Representatives and the United States Congress. We have to have that same mindset. And that is why the voters put Donald Trump in the White House and gave a unified control of government to the Republican Party. While several programs are eliminated or reduced, the bill increases support for biodefense, rural hospitals, and school choice. The bill also maintains support for Pell Grants and investments in early childhood education. In conjunction with the bold leadership of President Trump to terminate diversity, equity, and inclusion, those policies that were put in place by the previous administration, this bill codifies their removal, stopping them once and for all. And building on the success of the big, beautiful bill, this bill eliminates the funding of Planned Parenthood. It also protects the right of women and girls to play sports fairly and not compete directly with men. It prohibits any federal funding from going toward enforcing gender identity politics or social, hormonal, or surgical interventions to change a child's sex. The bill maintains the longstanding Hyde Amendment to ensure that taxpayer funds are not used for abortion on demand and that no one is forced to participate in an abortion or refer for one under federal programs. This isn't right-wing extremism. This is mainstream public opinion. The bill also makes sure that the taxpayer dollars are not used to circumvent state laws which restrict access to abortion and ensures that the American tax dollars don't support research using fetal tissue from an abortion. The bill supports American businesses, farmers, and entrepreneurs by including provisions protecting the rights of independent contractors and ending forced wage rates for agricultural workers. In addition to thanking Chairman Cole, I also want to thank this committee staff on both sides of the aisle, as well as my fellow subcommittee members also on both sides of the aisle, and also their personal offices for their hard work and their input as we crafted this bill. It has taken several weeks to get here, and I know there'll be a lot of work has gone into this and making this bill what it is before us today. Of course, I think it goes without saying that we will all have different opinions about the policies in this bill, both as they relate to spending on federal programs and the provisions supporting the administration's efforts. But I want to remind everyone, we are all sincerely want to represent the views of our constituents respectfully. I look forward to our continued discussion on these issues in the full committee's markup. And I would like to now recognize the ranking member, Rosa DeLauro, for her opening remarks.
Thank you so much, Mr. Chairman. Thank you for your good wishes. We do agree and disagree on issues, but I'm much appreciative of your good wishes and that of the chairman, Mr. Cole. I'm back and then ready to do business, even though I have a cane that I'm walking with for a little while. So, but it's good, and I'm really grateful to both of you. I want to also express my appreciation for the staff on both sides of the aisle. In particular, I want to say thank you to Stephen Stegleiter, Philip Tizani, Jackie Kilroy, Laurie Mignone on the minority staff. And on the majority side, let me just say a thank you to Catherine Salmon, Emily Goff, James Redstone, Kirk Boyle, Jaime Varela, and Matthew Kleinman. I think it comes at no surprise that I oppose the bill before us, which would cut funding for education, healthcare, labor programs by $24 billion, more than 10%. But before I dive into the details of why this bill would be disastrous for American families, I want to talk about the bigger picture, about what is happening in the country at this moment. Right now, the actions of this malicious and vindictive administration are hurting the middle class, the working class, and the vulnerable across every single one of our districts and taking us back decades. Americans are struggling with rising costs of everyday necessities. They are living paycheck to paycheck. But the President and House Republicans are not laser-focused on the cost of living crisis. They are making it worse. Right now, the Trump administration and House Republicans are working to dismantle our health care and public education systems. In the first 6 months in office, Republicans passed a bill to cut nearly $1 trillion from Medicaid and the Affordable Care Act, which will take away health care coverage from more than 15 million people. A more than $500 billion cut to Medicare is approaching, harming America's seniors. Slash nutrition benefits for poor families, which would lead to an additional 1 million kids going hungry. All to pass trillions of dollars in tax cuts for the big corporations and billionaires, adding $4 trillion to the national debt over the next 10 years. At the same time, President Trump and House Republicans are marching toward their goal of shutting down the Department of Education and turning public education into a for-profit enterprise. In March, President Trump signed an executive order seeking to eliminate the Department of Education. Elon Musk and Doge fired or pushed out half of the Department of Education's workforce. OMB Director Russ Vought illegally froze billions of dollars in funding for education programs that every one of our districts rely on, like after-school learning programs, teacher training programs, English language learning, and school enrichment programs. And now, Republicans are eviscerating our public health system and promoting Secretary Robert F. Kennedy Jr.'s anti-vaccine ideology. The Center for Disease Control and Prevention used to be the crown jewel of public health information and guidance on vaccines that save so many lives in this country. Now it has been taken hostage by liars and conspiracy theorists. On August 8th, the CDC, still reeling from mass layoffs, was horrifically attacked by a shooter whose mind had been twisted by misinformation about COVID vaccines. He murdered a police officer, Officer David Rose, a Marine veteran. During the attack, CDC staff who were picking up their children at daycare laid on top of their kids to shield them from bullets. The police found more than 500 shell casings. Weeks later, there are still bullet holes in windows and shards of glass in CDC offices. How has RFK Jr. responded? Last week at a news conference in Texas, he doubled down on vaccine conspiracies and faulted CDC for listing vaccines among the top advances in medical science. RFK Jr. has no scientific or medical expertise. He pushes deadly conspiracies, spreads lies and misinformation. We know his agenda. He wants to take away life-saving vaccines from kids and from families. RFK Jr. fired all 17 independent scientific advisors on the Advisory Committee on Immunization Policy, or ACIP, and replaced them with anti-vaccine acolytes. He hired an unqualified and discredited vaccine skeptic as the top advisor on vaccine policy. Just last week, President Trump fired the CDC director, Dr. Susan Manares, for refusing to rubber stamp RFK's anti-vaccine agenda that will hurt millions of children. On the same night, 3 of CDC's foremost experts on influenza, respiratory diseases, and infectious diseases chose to resign rather than go along with RFK Jr.'s unscientific and dangerous demands to restrict access to life-saving vaccines for children. Dr. Dimitri Daskalakis said in his resignation letter, and I quote, "Their desire to please a political base will result in death and disability of vulnerable children and adults," unquote. Dr. Deborah Horry, who said in her resignation letter, and I quote, "Vaccines save lives. This is an indisputable, well-established scientific fact," end quote. And according to a bipartisan group of 9 former CDC directors who served under both Democrats and Republicans, quote, "Families with low incomes who rely most heavily on community health clinics and support from state and local health departments will have fewer resources available to them. Children risk losing access to life-saving vaccines because of the cost. This is unacceptable, and it should alarm every American, regardless of their political leanings," end quote. ACIP is scheduled to meet this month to consider recommendations for an array of vaccines, including hepatitis B, COVID, RSV, and the combination of vaccine for measles, mumps, and rubella. Senator Cassidy, chairman of the Senate Health Committee, has called for the ACIP meeting to be postponed. Senator Cassidy said, and I quote, "If the meeting proceeds, any recommendations made should be rejected as lacking legitimacy given the seriousness of the allegations and the current turmoil in CDC leadership," end quote. I agree. The ACIP meeting must be postponed. All original ACIP members must be reinstated. Moreover, if they are not, it is imperative that RFK Jr.'s handpicked anti-vaccine members of the committee be replaced immediately by true immunization experts. RFK was never qualified to be the Secretary of Health and Human Service. He should be fired immediately. Now we have the fiscal year 2026 appropriations bill up before us, which continues the Republican assault on education, health care, and workers. Once again, this bill decimates support for public schools, students, and K-12 school teachers. It abandons college students and lower-income workers trying to gain an education or advance their career for the chance at the American dream. Overall, the bill cuts the Department of Education by $12 billion, 15%, $4.7 billion cut to Title I, which will take at least 72,000 teachers out of low-income classrooms. Hardworking families pay taxes, send their children to local public school, but this bill says we cannot afford to put a teacher in their child's classroom. English language acquisition funding to help more than 5 million English learners nationwide is eliminated, disadvantaging and discriminating against students who primarily speak another language, hurting their future ability to compete and succeed in the American economy. Supporting effective instruction state grants, which provide professional development opportunities for educators, are completely gone. Work-based financial aid for federal work study for 222,000 students who needed to help finance their post-secondary education is cut by $450 million, limiting their potential earnings and future success in the job market. And need-based financial aid for more than 1.6 million low-income students who use the Supplemental Educational Opportunity Grants, SEOG, to finance their education is completely eliminated. I find it ironic that this bill was released on Labor Day, when it slashes worker protections, abandons the working class, allowing corporations to exploit American workers' safety and rights, and promotes cheap foreign labor. Overall, it cuts the Department of Labor by 30%, eviscerating job training programs by more than 50%, eliminating funding for adult job training, youth job training, the Job Corps program, destroying job training and career development opportunities for more than 300,000 adults and more than 150,000 young adults. Once again, the majority's bill would harm women's health, children's health, public health, surrendering the safety and well-being of the American people to multiple health crises. It completely eliminates funding for the HIV/AIDS prevention at CDC, a cut of more than $1 billion. It cuts HIV/AIDS treatment under the bipartisan Ryan White program by more than $500 million. The first Trump administration proposed a new initiative to end the HIV epidemic. And the second Trump administration, on the other hand, has abandoned the fight. The bill would eliminate funding for Title X family planning, which would be the end of support for preventive health care services, including contraception and cancer screenings, for 2.6 million low-income women and men. And it would eliminate funding for the teen pregnancy prevention program. It also eliminates the tobacco prevention programs, as well as the gun violence prevention research, just days after a horrific school shooting while children were praying in church. The bill cuts NIH research funding by $500 million. This comes as Russ Vought has canceled previously award grants, throwing away potential life-saving cures or treatments, and wasting millions of dollars in the process. It is sad because it is not long ago that I worked on a bipartisan basis with Chairman Cole for 8 straight years to provide annual funding increases for NIH research. Biomedical research used to be a bipartisan priority in the Congress. Sadly, those days seem gone. And in keeping with the majority's other bipartisan bills, this bill includes the usual poison pill riders, multiple provisions that target abortion rights, reproductive health care services. Policy riders in the bill create an open season for discrimination against LGBTQ individuals. They prohibit policies and programs intended to promote diversity in the federal government. I'm truly exasperated that the majority is taking this subcommittee, the Congress, and the American people down this path once again. I would urge my Republican colleagues to say enough. Stop supporting anti-vaccine lies. Stop cutting Medicaid. Stop destroying public education. And stop hollowing out our health care and public school systems. This 2026 Labor, Health, and Human Services and Education bill only deepens the harm wrought on the middle class, the working class, and vulnerable Americans. Cannot support this never-ending attack on our health care, public school system, and our workers. I urge my colleagues to vote no. I thank you, and I yield back.
Thank you. I'd now like to recognize our distinguished chairman of the full committee, Mr. Cole, for his remarks.
Thank you very much, Mr. Chairman, and thank you to Ranking Member DeLauro, and I want to join you in wishing her the very best after surgery. You're clearly in fighting trim, so I know you're back, and I'm delighted about that. And I want to thank, obviously, all the members of the subcommittee for being with us today. Today's measure funds the operations of the Departments of Labor, Health and Human Services, Education, and other related agencies. As the former chair of this subcommittee, I'm deeply familiar with its work, which touches the lives of all Americans. The bill provides appropriate and fiscally responsible funding to ensure these departments can continue to perform their core missions while also safeguarding American taxpayer dollars. The legislation maintains funding for important education programs such as TRIO and Gear Up and Pell Grants. It supports rural hospitals, public health programs, and robust funding for biomedical research. It invests in the nation's biodefense infrastructure and also maintains safeguards for vulnerable populations such as Americans with disabilities and seniors. Importantly, the bill supports the Trump administration's efforts to eliminate out-of-touch progressive policies, ends the weaponization of government, preserves parental rights, and upholds the right to life. Each dollar is directed toward initiatives that truly help our communities, students, families, and workforce. I want to thank Chairman Adderholt, Ranking Member DeLauro, and the majority and minority staff for their hard work. I look forward to consideration of this bill today. With that, Mr. Chairman, I yield back.
Thank you, Chairman Cole. At this time, is there any other members who would like to make any kind of open remarks? Yes, Mr. Hoyer.
I suspect there will be a few.
Thank you very much, Mr. Chairman. You'd be surprised if I didn't make the observation this is not a markup. No amendments are going to be offered. No issues will be thoroughly discussed by both sides as to the merits of the proposal. It will be a little bit like Doge. We'll know how to cut. We will not know the consequences of those cuts. In one respect, we will not know the consequences of those requests because we only had 3 hearings. Then we had 5 hearings. We had 2 hearings at the beginning in February, and then we had 3 hearings in 1 week. No testimony from anybody who's worked at the Department of Education, who's worked at the Department of Labor. Not a single witness from the National Institutes of Health was asked to testify. I've served on this committee when every institute was asked to testify on the merits of its budget and the prospects of success. This budget says you're on your own. That is the message the Trump administration has sent to the American people the past 7 months. From the Centers for Disease Control to the National Institutes of Health to the VA, Donald Trump and Russell Vought have purged researchers, suspended medical trials, and politicized American science. America will not be great if we continue along that path. One of Trump's first actions this year was to pause all federal grants, including those for research into new cures and treatments for cancer and other life-threatening diseases. We've seen staffers fired from the CDC, as Ms. DeLauro pointed out. 9/11 World Trade Center health program cut. Last week, the New York Times reported that Pediatric Brain Tumor Consortium, an institution dedicated to treating the brain cancer in children, will no longer receive federal funding. Is that what we're for? Anybody discuss that? Did the president in his campaign that our chairman spoke about say to the American people, I'm going to cut research on pediatric cancer? Of course not. The American people don't support that. Recently, the Supreme Court allowed Trump to maintain his freeze on some $2 billion in NIH grants. Just days ago, Trump purged the CDC director after removing the agency's entire vaccine advisory committee earlier this summer. A contagion is burning through this administration. Utter delusion. I don't like everything in this bill, as you'll find is no surprise, especially it zeroes out funding for full-service community schools to the detriment of countless vulnerable children across the country, including tens of thousands in Maryland. Programs that have been supported over the last 4 decades by a bipartisan group of men and women who care about making sure that we educate our children. Bill Natcher, who chaired this committee many years ago, said, if you take care of the health of your people and the education of your children, you'll continue to live in the strongest and best nation on earth. I share that perspective. I think most of you share that perspective. This bill does not do that. Well, I am relieved, very frankly. The bill doesn't indulge some of the Trump administration's worst impulses. The American people deserve better than expected. They deserve our best. They deserve our best thinking, collegially our best thinking. Trump and Vought have made it clear that they will bypass the Congress to accomplish their own political objectives and strengthen their own power. Mr. Chairman, you said we're going to hit the ground running. There are only 28 days left until the appropriation process has failed. That's not running. We didn't have hearings until May. We had 2 informational sessions that were very helpful, and I was interested in them. But they were not hearings from people who were running programs or proposing how we should proceed. They were supporting things. Trump and Vought in particular, would like to make this committee irrelevant. I speak about the Appropriations Committee. Has said he'd like to make it more partisan. I don't know how it could be more partisan than 37-24. Every vote,
38-23.
38-23. Who's counting? Some people think that's funny.
I thought it was kind of funny.
The legislation before us today means very little if Trump simply refuses to spend the funding we appropriate, as he just did with his pocket rescission of nearly $5 billion in congressionally approved foreign aid. My friend said amen to that. Maybe he thinks that was the right thing to do. If it is, then we ought to adjourn right now and not pretend that we're making decisions that make a difference. Unless we assert our authority, the administration will keep purging scientists. It will keep I'm almost through. It will keep disrupting medical research, turning the cancer moonshot into a pipe dream. It will keep jeopardizing the health of the American people. I believe a day is going to come when Americans no longer have to live with the fear of cancer. But they will not do so if we pursue these kinds of policies. I yield back the balance of the time I don't have.
Good point. Is there any other members who wish to make any opening comments? Right. Let me just say, I do want us to be mindful of the time because we do have votes starting shortly. But you are recognized.
Yeah, thank you so much. Recently, I held a town hall with about 100 seniors. One by one, they told me they feel scared and hopeless because of Donald Trump's agenda. An 80-plus-year-old woman, one of my younger constituents, her voice shaking, called Robert Kennedy Jr.'s policies extreme and dangerous, and she said through tears that his reckless crusade against vaccines is putting her great-grandchildren's lives at risk. Another voice was a retired teacher. She devoted her life to giving kids a fair chance, but now she's alarmed that the Trump has dismantled the Department of Education and abandoned the students who need us the most. She told me, the crew, if we give up on public education, we're giving up on America's future. And sadly today, instead of protecting families, this budget rubber stamps cruelty and denies common sense. It wipes out CDC programs that fight HIV, measles, and tuberculosis. It eliminates funding for Planned Parenthood and slashes family planning, cancer screenings, and other basic health services. It eliminates protections against job discrimination and erases the Women's Bureau. It rips teachers out of classrooms and tells kids in the poorest schools their futures don't matter. And it cuts investments in the workforce, programs that help train for the good jobs and lift people, and lift families into the middle class. And I can tell you this, is not lower costs in day one, as promised by our president. And these cuts are not just numbers on a spreadsheet. They're the mom who misses her cancer diagnosis, the worker who can't get the skills to land a better paying job, the child left behind without a teacher. Budgets reflect our values, and this one says to seniors, women, working families, and children, you're on your own. This is the Trump age of survival of the fittest. And I believe we can do better, and I hope that together we can shape this bill into something worthy of the American people. And I yield back.
Ms. Frankel? Any other members? Ms. Dean?
Thank you, Chairman Cole, Chairman Adderholt, Ranking Member DeLauro. I rise in opposition to this bill, which fails to address the cost of living crisis facing American families, the crisis that this president said he was going to tackle on day one. Well, we're 7 months in, and what has happened? Thanks to this administration's disastrous economic policy choices, we are facing increasing costs a lagging job market with data showing a slowdown in hiring over the last few months, which promises to continue because of all of the uncertainty. But instead of investing in the workforce at a time when it is most needed, this bill cuts funding for the Department of Labor by 30% compared to FY25. This bill cuts funding for Job Corps in half, a key program for low-income young adults to receive career and educational training and begin their own careers. And this bill cuts funding for Workforce Innovation and Opportunity Act state grants by 63%. As we all know, our states use this funding to carry out workforce development programs. Given the shakeups coming from Washington, it would seem to me that this programming is needed more than ever before. Further, after my Republican colleagues voted earlier this summer to take health care away from millions of families to fund tax cuts for the rich and blow up our deficit under the one big repulsive bill, this bill continues the assault on our health care system. Top line, this bill cuts funding for HHS by 6% compared to FY25. Notably, this bill harms women's and children's health by cutting programs that provide access to key health services and contraception. While I'm grateful that this bill does not enact Secretary Kennedy's ill-advised vision for an administration for a healthy America, this bill does not sufficiently address the health risks facing America. This bill cuts funding for the CDC by $1.7 billion, including, and I have a hard time even saying these words, including eliminating funding for domestic and global HIV/AIDS activities. This bill also cuts NIH funding by $456 million and cuts SAMHSA funding by $298 million, just at a time when we were finally making some progress on reducing the number of overdose deaths in this country. But here we are, the first week of class, the very first day of class for my grandchildren. Let's talk about education. This bill cuts funding for the department by 15%. I suppose I should acknowledge here that at least the Republicans in writing this bill are not eliminating the department, as promised by the Secretary and the President and Project 2025, but that's really about the best thing I can say about that title of the bill. The fact of the matter is that this bill unacceptably underdelivers for our children at a time when they need it most. This bill cuts funding for K through 12 education by more than $9 billion. Think of your own kids. Think of your grandchildren. And this bill slashes key federal student aid programs. I also used to teach at a university. This was an exciting time of year with a new year and a new semester. But this bill slashes key federal student aid programs, including eliminating funding for the federal Supplemental Education Opportunity Grant Program. Finally, this bill reflects my Republican colleagues' continued concessions to the president's ego. It cuts funding for AmeriCorps and renames it, please listen to this, renames AmeriCorps America First Corps. That is a clumsy distortion of that agency's important work over the past more than 30 years. The mission is uniting America through service, not America First Corps. And it eliminates funding for the Corporation for Public Broadcasting, a perennial target of President Trump, I don't understand why, which will hurt local stations that provide critical services to Americans. Colleagues, this is not the bill the American people deserve. We are, as Mr. Hoyer has said, we are not doing the work that we were called to do. We must do better. I urge my colleagues to support me in opposing this bill, and I yield back, Mr. Chairman.
Thank you, Ms. Dean. Anyone else? Ms. Watson-Coleman.
Thank you very much, Mr. Chairman and Ranking Member. I urge my colleagues to oppose this bill. It will make our nation more vulnerable to disease, it will make our workforce less prepared for the future, and it will worsen the already unjustifiable racial health disparities that have devastated Black, brown, and other communities of color for generations. Hardly 3 years after the end of the worst global pandemic in 100 years, a pandemic that took the lives of 1 million people in America, this bill slashes the CDC funding by $1.7 billion. There is already a clear crisis of confidence in this administration's management of the CDC. This bill signals to the men and women charged with keeping our country safe from disease that they are not valued, that this administration does not believe in their mission, that science must take a back seat to the ego and the arrogance of the health secretary and the president. That's not going to make America healthy. It's going to make and keep us sick. This bill eliminates funding for domestic and international HIV/AIDS prevention entirely, a devastating disease for which there is still no widely accessible cure, and this administration has just decided to throw its hands up and walk away, turning its back on the 40 million people globally living with HIV/AIDS. We will see a surge in new cases and a catastrophic spike of upwards of $60 billion in costs to our healthcare system. That we are choosing to walk into this nightmare is a scathing indictment on this body. This bill slashes funding for the Office of Minority Health by 40%. It is an objective fact that racial minorities are more likely to get sick and not recover and less likely to receive care when they do. Cutting funding for the office that tracks this phenomenon and works to address it will not make it go away. This is a policy of willful ignorance. It is a whitewashing of health science. It is yet another example of this administration's racist disregard. Let me say that, racist disregard for anyone who is not white and wealthy. While I am heartened to see a small boost in funding for LIHEAP, I have to ask my Republican colleagues, if there is no substantial staff to administer this vital program, how exactly do we expect LIHEAP to be executed? Pretending you support LIHEAP while doing nothing to advocate for the workforce responsible for carrying it out only demonstrates that your advocacy is an inch deep. Beyond the far-reaching health repercussions, this bill proposes to cut billions from job training grants. Just as our country is poised to undergo dramatic shifts in the workforce as AI eliminates entire categories of jobs, and just when it's more important than ever to provide American workers and their families with the protection and support that they need to live fulfilling lives and meaningful lives. So while the president courts the billionaires making a killing off the AI revolution, Republicans are hanging the workers who will be displaced by this rapidly evolving technology out to dry. Eliminating funding for Youth Corps and Job Corps, adult job training, and cutting funding for Job Corps in half are all sickening examples of this distaste from this administration for everyday people's lives. At a time when technology is bringing our country quickly into the future, this bill looks backwards. It leaves us vulnerable to diseases that could otherwise be treated. It leaves us unprepared to respond to massive shifts in the labor force, and it takes us back to the whitewashed, racist health science of past generations. So I urge my colleagues to oppose this bill. I thank you, Mr. Chairman. I yield back.
Thank you, Ms. Thank you for your comments. Mr. Clyde, you're recognized.
Thank you, Mr. Chairman. First, I want to say I'm very, very thankful that this committee included Section 117, which is none of the funds made available by this act may be used to administer, implement, or enforce a Biden administration final rule entitled Adverse Effect Wage Rate Methodology for the Temporary Employment of H-2A Non-Immigrants. And also it defunded the final rule entitled Improving Protections for Workers in Temporary Agricultural Employment, which it really doesn't do that. But these two rules have dramatically increased the cost for rural farmers and made their jobs much more difficult in the production of what we need in this country, and that's food. So I'm thankful for Chairman Adderholt for your leadership and for including this very important addition that will protect our farmers and our nation's food supply. And I ask all my colleagues to support this bill, and I yield back.
Thank you, Mr. Clyde. Anyone else like to speak? Mr. Pocan.
Oh, thank you, Mr. Chairman. I'm not going to read a statement because I think our ranking member and other members did a great job of explaining the cuts to K-12 education, to the Job Corps program, NLRB, HIV funding, cancer prevention, on and on and on. We all just got back from 5 weeks at home reality. And as soon as I land, I feel like I've entered a Saturday Night Live episode, an ongoing one that never ends until I get back on the plane to Wisconsin. Unfortunately, it's not funny because it's something we've done by giving up our Article 1 constitutional responsibilities when it comes to spending. Instead, we're going through this process. We know this bill will never become law. We're going to continue to play fantasy Congress for the next several weeks. I'm looking forward to having lots of fantasy Congress amendments next Tuesday. But I think what's saddest is just when you look at this bill, the levels of absurdity in a couple items just kind of show what we've all broken down to be in this Saturday Night Live episode. We're cutting the AmeriCorps program in half, and then we're going to name it the America First Corps. I mean, just the ridiculousness of that alone says so much. But my favorite, I think, is after the big ugly law is going to risk Pell eligibility for so many people, and we're cutting all these job training programs in this budget, we renamed the workforce Pell grants to be Trump grants. Because, of course, why not, right? This is the reality. So I don't know. I'm nice and calm from spending 5 weeks away from here. I'm going to enjoy everything tomorrow with our markup and next Tuesday and I think the following day as well. But to read a statement and to play into this fantasy Congress, I'm still in my Wisconsin spirit, so I'm going to leave it at that, Mr. Chairman. But it is unfortunate, though, that we're not actually doing real Congress. Article 1, Constitution gives us the power of the purse, and the fact that we're completely ignoring that, I think, is unfortunate for all of us, and hopefully it doesn't set future precedents. But I yield back.
Thank you. Thank you, Mr. Pocan. Any other comments? I now recognize Ms. Litlow for the purpose of making a motion.
Mr. Chairman, I move the bill be favorably reported to the full committee.
The question is on the motion. Those in favor say aye.
Aye.
Those opposed say no.
No.
The ayes have it. The motion is agreed to. A recorded vote has been requested. All those in favor of recorded vote, raise your hand. A sufficient number in support, a recorded vote is ordered, and the clerk will call the roll.
Mr. Adderholt.
Aye.
Mr. Adderholt votes aye. Mrs. Bice. Aye. Mrs. Bice votes aye. Mr. Clyde. Aye. Mr. Clyde votes aye. Mr. Cole.
Aye.
Mr. Cole votes aye. Ms. Steen. Ms. Steen votes no. Ms. DeLauro.
No.
Ms. DeLauro votes no. Mr. Elzey. Mr. Elzey votes aye. Mr. Fleischman. Mr. Fleischman votes aye. Ms. Frankel. Ms. Frankel votes no. Mr. Harder. Mr. Harder votes no. Dr. Harris. Dr. Harris votes aye. Mr. Hoyer. Mr. Hoyer votes no. Ms. Letlow. Ms. Letlow votes aye. Mr. Molinar. Mr. Molinar votes aye. Mr. Moore. Mr. Moore votes aye. Mr. Pocan. Mr. Pocan votes no. Mr. Simpson. Mr. Simpson votes aye. Mrs. Watson-Coleman. Mrs. Watson-Coleman votes no.
Does any member wish to record their vote or change their vote? The clerk will tally. On this vote, the ayes are 11, the noes are 7. The bill is favorably reported to the full committee. I ask unanimous consent that staff be permitted to make technical and conforming changes to the bill and report. Without objection, so ordered. Copies of the bill and the report with the technical and conforming changes will be delivered to all full committee members' offices no later than 3 business days before the full committee. Thanks very much for everyone for being here. That concludes today's markup, and the committee now stands adjourned.